What are assessments of autism spectrum disorder? Okay, so when a child has been flagged for autism through screenings, what does an assessment look like? It's a great question. Hi, I'm Dr. Teresa Lyons. I teach parents the cutting-edge science of autism so that you can make the best decision for your child based on quality information. Most autism diagnoses are made by a specialist. So when I'm talking about assessments for autism, it's by a specialist overseeing it, not a general pediatrician. Typically, the assessment is referring to developmental status. Basically, what age is your child functioning at, which might be very different than their actual age. This is typically done before the specialist makes a diagnosis. There are questionnaires such as the SCQ or the Social Responsiveness Scale. Other ways to assess a child for potential autism diagnosis are the Behavior Assessment System for children, the Diagnostic Interview for Social and Communication Disorders, and the Child Behavior Checklist. They are used to assess children for other behavioral health conditions, but they may also identify behavioral profiles that are consistent with autism. There's also the Autism Diagnostic Inventory, revised edition, and structured observation is also another way to assess a child for autism. There are two validated observation tools used to provide structured data to confirm the diagnosis. And those two are the Autism Diagnostic Observation Schedule, second edition. It's abbreviated ADOS2. And also the Childhood Autism Rating Scale, second edition as well. There's no single observation tool that is appropriate for all clinical settings for all children. That's why there's so many to choose from. Those with autism may have intellectual abilities, learning disabilities, ADHD, anxiety disorders, or speech and language disorders, as well as many other different comorbidities. These conditions may influence the presentation of the symptoms of autism and also may influence the social and behavior aspects of the child, depending on their age. As you can see, this is why you want to work with a specialist. There can be many more aspects that a specialist might want to review before giving an autism diagnosis. However, when someone refers to assessments for autism, these are the typical observational-based assessments. And as you can see, there are many ways and types of assessments for autism. You don't just want to pick one. It certainly can be frustrating, and this is why you want to work with an autism specialist. Work with a doctor who is familiar with all of these assessments so that you get the correct diagnosis the first time. If you found this video to be helpful, please hit the like button and also subscribe to my channel to get the cutting-edge scientific information about autism so that you can make the best decision for your child based on quality information.